Welcome to the WISE e-learning module on Crisis Planning and Intervention Services. In this module, you'll learn about the crisis and safety services and supports available under WISE and how these services look different from other crisis services. Under the category of Mobile Crisis Intervention and Stabilization Services, WISE offers crisis planning and prevention services, telephone support, as well as face-to-face interventions that support the youth and family within their community. This includes crisis planning, assessment, stabilization, referral and coordination, and post-crisis follow-up. WISE takes both a proactive and reactive approach to crisis supports and services. We will explain these approaches and the service above in more detail as we move through this module. Crisis supports and services begin with planning and assessing. Effective crisis planning is a critical component of an effective care plan. Each youth and family participating in WISE must have a crisis and safety plan. This plan is a family-friendly 1 to 2 page document that the CFT creates to address potential crises that could occur for the youth and their family, and is a plan to ensure everyone's safety. Let's get a better understanding of how crisis and safety planning is discussed within the WISE process. In WISE, we have 3 steps in crisis planning. First step, it's to help the youth and family define what a crisis means to them. Second step, help youth and family identify what leads to a crisis. And third step, help the youth and family understand the crisis cycle. The first step is to help the youth and family define what a crisis means to them. This is extremely important because we all define a crisis differently. At this step, we begin to brainstorm with the family and youth what crisis means to them. A good question to begin this conversation is, when is it that you just don't know what to do? After a crisis is defined, the second step is to help youth and family identify what leads to a crisis and how to anticipate a crisis based on past behavior. Based on how they defined a crisis, the CFT members help them identify what were some things that led to that. Examples include new situations, stress and emotions, change in routine, grief and loss, medication issues, health and psychiatric issues, stress relationships, and need for structure. This is the only time WISE is not strength-based. Why? Because we're asking families to think of worst-case scenarios and situations to help them understand what leads to a crisis. The last step is helping youth and families understand the crisis cycle. A crisis refers not necessarily to a traumatic situation or event, but to a person's reaction to an event. One person might be deeply affected by an event, while another individual suffers little or no ill effects. The crisis cycle acknowledges the opportunity to learn from a crisis, which is also known as proactive crisis planning. A proactive plan describes what we're going to do before the crisis point. Assure that you're planning to meet the needs of the whole family. When families and youth understand and know what leads to a crisis, teams are more equipped to create effective proactive plans. Each crisis plan should include the following elements. Based on youth's history and needs, plans should anticipate the types of crises that may occur. Crisis identification and prevention steps, including CFT members' roles related to proactive interventions. These interventions minimize the occurrence and severity of crisis. Plans should include crisis response actions, using a tiered approach to address the severity level of the crisis situation. It should be prioritized according to seriousness and likelihood of occurrence. Each plan should have 24/7 response, formal and natural supports, respite, backup care, details of what leads to a crisis, potential precipitating events and methods to reduce or eliminate these events from occurring, successful strategies that have worked in the past, as well as strength-based strategies that prevent and avoid escalation toward a crisis and ensure safety. Make sure to address the needs of the involved systems, legal mandates, and community safety. Plans should have clear behavioral benchmarks that change over time to reflect progress, changing capacities, and changes in the youth family's expectations. A post-crisis plan for evaluating the management of the crisis and overall effectiveness of the plan should also be addressed. Key points to keep in mind when prevention planning are: help youth and family identify triggers and stress behaviors, the warning signs, interventions that helped or didn't help, and things the team should or shouldn't do. It's important to rely on support people who will not escalate a crisis. And most importantly, remember that the family and youth own the plan. Because crisis planning is a skill teaching opportunity, here are a few things to remember. 1. All behavior is an expression of an unmet need. 2. If people feel more control over their lives, they will make better decisions. 3. Research shows that just by making an actual plan, it reduces the percentage of a crisis happening. Therefore, if you are worried about something, make a plan for it. Lastly, the CFT reviews the crisis plan regularly to assure information is up to date and modified as needed based on the changing situation of the youth and family. The next area of supports and services are stabilization services. These services are intended to stabilize the youth in crisis by reducing or eliminating immediate stressors. This includes providing counseling to assist in de-escalating behaviors and interactions. The services provide treatment and intervention in a location best suited to meet the needs of the youth and family in the least restricted environment available. In WISE, mobile crisis and stabilization services are available 24 hours a day, 7 days a week, 365 days a year. They are typically provided at the location where the crisis occurs, including the home or any other setting where the youth is naturally located, including schools, recreational settings, childcare centers, and other community settings. Each WISE provider agency must have a capacity to respond to destabilizing events whenever the need arises. Individuals who know the youth and family's needs and circumstances, as well as their current crisis plan, will respond to crisis episode and are preferably drawn from the team. Crisis responders may partner with others outside the team if necessary and when it's written into the crisis plan. The reactive planning portion of these services is what the CFT will do after a crisis has happened. After the crisis has passed, a team meeting is scheduled. This meeting should occur within 3 days following a crisis. While waiting for the CFT meeting to occur, the team should have an agreement to make no major decisions until at least 72 hours has passed. During this time and for the days that follow, WISE practitioners and other team members will coordinate with any current providers and team members to provide or refer the youth to any services and supports necessary to ensure continued safety, continued stabilization, or to prevent future crisis from occurring. If the crisis results in the youth being placed at a home, WISE practitioners will coordinate services between the out-of-home provider and the CFT to facilitate a plan for rapid return home. After a crisis, the CFT will evaluate the management of the crisis and overall effectiveness of the plan. The CFT will make adjustments to the plan as necessary. In the last topic of this module, we will discuss crisis services within the transition phase. During this phase, plans are made by the CFT for a purposeful transition out of WISE. This includes the CFT creating a post-WISE crisis plan that includes action steps, specific responsibilities, and communication protocols. Planning may include rehearsing responses to crisis and creating linkage to post-WISE crisis resources. New members may be added to the team to reflect identified post-transition strategies, services, and supports. The team discusses responses to potential future situations, including crisis, and negotiates the nature of each team member's post-WISE participation with the youth and family. Crisis drills should be practiced, and the youth and family should be confident when they know what to do should a crisis arise after they transition out of WISE. Thank you for participating in the WISE module on crisis services and supports. This is the last module in this series.